I honestly thought I do not have to talk about COVID anymore. There was absolutely no plan to make this video. I am doing this on SOS basis, looking at the rising case numbers in India.
I have been working nights recently, so please excuse my disheveled appearance.
Namaskar, hello, welcome to my channel. My name is Pritha. I am an Indian doctor now working in London and I am worried. Earlier this week, India crossed 100,000 cases in one day for the first time since the beginning of the pandemic. UK thankfully is on the path to recovery and more than half of the population has received at least one dose of the vaccine. The case numbers have dramatically fallen and we healthcare workers are gradually getting back to our pre-COVID routine. But it still is too early to let go of all guards, and even though lockdown restrictions are slowly being eased off, we must carry on social distancing, hand hygiene and using face covering. People living in India must be far more careful about coronavirus prevention, as if the infection follows the same trend as the UK, the second wave is going to be brutal. Thankfully, today we have an army of vaccines, but they obviously will not work if we refuse vaccination. Unfortunately, there's a lot of vaccine hesitancy, largely influenced by fake news that are freely circulated in the social media space. I understand it can be challenging to differentiate truth from lies, but fear not, as today I will be busting 10 popular myths on coronavirus vaccines. I also have an Instagram account where I upload tips and advice on health and well-being. You may wish to check that out too. So let's come to the myths. The first one being that vaccines were quickly made, so they must be unsafe. This probably stems from the knowledge that other vaccines take years to be made and approved. So how did we manage to get vaccines ready to use in less than 1 year? Well, vaccine development takes many steps, starting with procuring enough funds. And as coronavirus pandemic rocked the entire world, disrupting lives and economies, for once, every individual, every firm, every government in the world tried to achieve one common goal: to eradicate the infection. And a massive amount of both public and private funds was allotted for vaccine research. This made a huge difference as researchers could focus on what they do best: research. Because of the urgency of the situation, governments had minimized the red tapes from the process, and I'm sure we all know how much time we could all possibly save if bureaucracy did not exist. So no corners were cut when developing the vaccines. The path was just made smoother and the journey was thus quicker. Clinical trials were easier too, as almost overnight hundreds and thousands of volunteers agreed to participate. Here in the UK, both my husband and I submitted our details and Vikram was selected for Novavax trial while I was randomly excluded as they already had enough participants. Multiple trials also ran parallel to each other rather than one after the other. Data from these trials were continuously processed and fed to the regulatory bodies instead of doing it all at once at the end of the trial. This meant that regulatory bodies got the opportunity to have rolling review of the data instead of having to do it all at once at the end. And they only approved when all data were rigorously checked and all necessary criteria met. Vaccine manufacturing was also done at the same time as the trials with the hope that they would be approved. This was a huge financial gamble but was made possible by the extra cash that was injected. There are a few different kinds of vaccines in the market, and all the technologies used are based on research that has been going on for years. The framework for the mRNA vaccine, for example, that both Pfizer and Moderna make, have been in development for the last 2 decades. The team at Oxford University, on the other hand, has been making vaccines for the last 30 years, and their COVID vaccine formula is tried and tested as it was successfully used in the past to make vaccines against Zika, flu, and even another kind of coronavirus called MERS. So basically, the template was already in place, built by years of research, and now the clever scientists did necessary tweaks to customize them for COVID. Lastly, I would like to mention the vaccine teams who have put everything else in their lives on hold and worked at an unprecedented rate to make this possible. Myth number 2, the vaccine changes our DNA. This probably arises from the fact that Pfizer and Moderna use mRNA technology. Now, RNA may sound similar to DNA, but they are not one and the same. DNA lives inside the nucleus of our cell, a place which is impossible for mRNA to reach. The vaccine merely provides the body a plan to develop immunity. It has no other function, and no, it is not any kind of computer chip either. If it makes any difference, I took Pfizer vaccine, which has mRNA. Myth number 3. The vaccine gives you COVID-19. None of the vaccines contain any live virus, so it just is not possible to get infected from any of them. Vaccines only help the body to develop antibodies against the virus, so if one is exposed in future, the body has necessary immunity to fight it. Myth number 4. The vaccine will not work against new strains. Now, viruses mutate. We all know that. Scientists certainly do, and they are constantly evaluating the efficacy of available vaccines. If there is any evidence of any vaccine being ineffective at any point, necessary steps will be taken. More importantly, if we can manage to cut down infection rates drastically by vaccinating all of us or most of us, newer strains will not get a chance to emerge. Myth number 5. The vaccine causes severe side effects. I find this a bit strange, as most of us have had some vaccination in the past, and we should all know that there can be some side effects of any vaccine. They are usually mild and can include symptoms like body ache, pain at injection site, feeling run down, or having low-grade fever. This is the body telling us that it is mounting an immune response against the virus, and this can easily be addressed with over-the-counter medication. Serious side effects are extremely rare, and we can convincingly say this as of today, millions and millions of people across the world have already been vaccinated. Myth number 6. The vaccine contains beef, pork, fetal cells, eggs. Now, none of the coronavirus vaccines contain any beef or pork or fetal parts, and religious leaders across all faiths strongly recommend getting the jab. Myth number 7. The vaccine causes infertility. There is nothing in any of the vaccines that can stop one from getting pregnant, and if antibodies caused infertility, then those who already had COVID infection would have struggled to conceive. So far, we have not observed any such thing, and all health bodies of the world, including WHO and the Royal College of Obstetricians and Gynecologists, of which I'm a part of, have published official statements confirming that coronavirus vaccination will not cause infertility. Myth number 8. I will not need the vaccine if I had COVID in the past. It has been shown that immunity against COVID wanes with time, and at the minute there is no evidence that enough antibodies exist in our bodies more than 6 months after getting infected. We still need the vaccine to boost our immune system for full protection even if we have leftover antibodies. I had COVID end of last year, less than 4 months ago, and I still went for full vaccination. Myth number 9. Delaying second dose will make vaccination useless. There is enough evidence to suggest that even after one dose, decent immunity is achieved, and both UK and India have recommended delaying the second dose. The idea is to get as many people get vaccinated with at least one dose as soon as possible to maximize the immunity level in the population. This will help to bring down the numbers, and it does not significantly affect the chances of success of the vaccine for an individual. In fact, I had my second jab 8 weeks after the first. Myth number 10. Those who had the vaccine will not need to follow any infection control measure. Unfortunately, we are still in the middle of a pandemic, and in addition to vaccination, we must follow social distancing, hand hygiene, and face covering rules. It takes time for body to mount full immune response, and in the meantime, one could still be vulnerable. Vaccines have impressive efficacy against severe illness, and a minority can still get mild infection even after taking vaccine. And it is possible to pass this on to other unimmunized people. Till the pandemic is brought under control and a decent herd immunity is reached, we unfortunately have to carry on being very, very careful. Please remember that in a matter of a year, more than 1 million people have died of COVID. My father-in-law was one of them, so I know firsthand the devastation it can cause. Now, these are the top 10 myths on coronavirus vaccine that I keep coming across in my news feed. I hope I have been able to provide you with a clearer picture, and that you would accept vaccination whenever you are offered one. We have been through this together, and finally there is some light at the end of the tunnel. We absolutely cannot afford to give up now. Please stay safe, please get vaccinated, and if you found this useful, consider subscribing to my channel. Thank you. Bye.